Hello everyone and welcome back to my YouTube channel. So today's video is about the most important questions of novel drug delivery system that is in your B Pharmacy 7th semester final year. So in the unit number 1 you have controlled drug delivery system. So firstly you need to know that there is a difference between controlled and sustained. Sustained means a release that is over an extended period of time. And controlled means the release is the rate of drug release from the dosage form is being controlled. There are many synonymous terms like modified release which further consist of controlled release, prolonged release, delayed release, extended release, and sustained release. So these are few terms that cannot be used interchangeably because they have slight difference amongst them. Let us see what is that. In prolonged drug delivery system, the drug will be released at a very slower rate for a prolonged period of time. In the delayed release, the drug release from the dosage form itself is delayed. That means it will not release slowly. It will release at a delayed period. Controlled release, I mentioned above that the release is controlled at a specified rate from the dosage form. Extended release, you can delay the release as well as delay the control of the release as well from the dosage form. Sustained release, similarly, you can sustain the release of the drug from the dosage form. In controlled drug delivery system, what is more important is that controlled drug delivery system follow zero order, this graph, and sustained release follow first order. This is first order is sustained, zero order is controlled. So this is very important because it is between minimum effective concentration and maximum safe concentration. So that is very important. Also, you need to know the classification of the polymers. Polymers can be classified on the basis of their swellability, swellable and non-swellable, on the basis of the hydrophobicity, hydrophilic and hydrophobic. They can be classified on the basis of the cationic or anionic, the charges present. They can be classified on the basis of source, obtained, natural, semi-synthetic, synthetic. They can be classified on the basis of different other classifications also are present for the polymers, but these are very important. One more is bioerodible and non-bioerodible. That is for certain polymers that do not require that elimination, they itself get eroded. Like in the eyes we have certain polymers, EVA, and there are so many polymers that are useful as bioerodible, PLGA, PLA, polylactoglycolide. That is, these are all important polymers. In controlled drug delivery system, you need to also know about the different release mechanisms. So release mechanisms can be diffusion, dissolution, and dissolution both combined, osmotic, altered density, that is gastroretentive, pH, and ion exchange, cationic or anionic depending upon the nature. And the system wherein you can incorporate can be matrix or reservoir. In reservoir, again you have two types, macro reservoir and micro reservoir. And mostly the release of the drug is via swelling or wetting of the polymer or via erosion. Now this erosion can be either bulk erosion or only the surface gets eroded. Bulk erosion or only the surface gets eroded. So from controlled drug delivery system, this is very important. The next is the unit number 2, in which you have microencapsulation. In microencapsulation, basically you have to study about coacervation, phase separation, air suspension, multi-orifice centrifugation, and spray drying and spray congealing. Now understand the difference between spray drying and spray congealing. Remember that way. Congealing means chilling. Molten wax, you can tell. Drying means hot air. Here you use cold air, here you use molten wax. Hot air and molten wax. So just remember the difference between spray drying and spray congealing. Multi-orifice centrifugation is based upon the principle of hurling. Air suspension is basically fluidization and suspended of the suspended particles. In coacervation phase separation, again you have 3 phases furthermore, which include coacervates formation, deposition, and rigidization. This can be achieved either via temperature, change in the pH, addition of electrolytes, or by non-solvent addition, any of the processes. But the major thing that you need to remember is that coacervates are basically like this small tiny particles. They get deposited like this, and then they form a rigid film. Suppose like this, they form a rigid film on the particle. So your particle gets encapsulated within the film of this coacervates, that is the polymeric solution, which is obtained from the liquid manufacturing vehicle phase. Here you can see the red one here is your particle and the green is the film. The next you have is osmotic release drug delivery system. So in that you have to remember the use of osmogens, and it is based upon principle of osmotic pressure and osmotic displacement, and mostly there is a small delivery orifice through which the drug gets released. And in implantable drug delivery system, only one pump you have to study, that is LZ pump. LZ osmotic pump. It is made by Alza Corporation. And LZ pump, one more peculiarity is that suppose if this is your osmogen, here is your drug. The fluid comes in contact with this osmogens. These osmogens create a osmotic pressure. Due to this osmotic pressure, there is a osmotic displacement of this drug, and due to this osmotic displacement, it comes out of the small delivery orifice at a controlled rate through the semi-permeable membrane. Do not forget the word semi-permeable membrane. It is mostly cellulose acetate, which is used as a semi-permeable membrane. And the next and the last one is the mucoadhesive and bioadhesive. These are basically those systems that adhere, that attach to your mucous membrane. And there are 2 stages, contact stage and consolidation stage. Another important thing that you need to remember is with respect to the theories. Wetting, adsorption, diffusion, electronic, mechanical, and fracture theory. These are very important theories that you need to remember when you speak about muco and bioadhesive delivery systems. The next you have is unit number 3. Unit number 3, you have gastroretentive drug delivery system, whereby you have high density floating system, hydrodynamically balanced system, low density floating system, which can be either effervescent or non-effervescent. Effervescent can be either volatile liquids or gases. The other systems that you have are mucoadhesive as gastroretentive. You have osmotic release, ion exchange. You also have one important gastroretentive drug delivery system that is very, very important, that is magnetically controlled, whereby you put a magnet outside and then you just direct the proper concentration of that drug into that particular region. That is magnetically gastroretentive drug delivery system. So that is very, very essential to know. And then there is a raft forming system, a swellable system, and an inflatable system. In the inflatable system, you basically have an inflating chamber, and some inflators are used for this inflation chamber. Raft forming, basically they form a viscoelastic gel barrier. They form a viscoelastic gel colloidal barrier. Hydrodynamically balanced, you just have, this is the tablet. When it comes in contact with the gastric fluid, which has a density of greater than 1, the system becomes hydrodynamically balanced. And then there is a proper release of the drug. Low density, basically, suppose if this is your stomach over here, this will be your low density system. It will be floating like this. This will be your high density system. It will sink at the bottom. And it will, the swellable system or the expandable system over here, you can see that I've drawn in green, I've drawn in blue. Here you can see they can be blocking the exit from the pylorus. They prevent the exit. One is either usko float करवाइए, दूसरा या तो उसको sink करवा दीजिए, तीसरा या तो उसका exit ही block कर दीजिए. So these are few different ways in which you can have a gastroretentive action. These are only for localized drug delivery system, जिसका actually local stomach पे जैसे antacids हो गए, or some drugs that degrade in the alkaline environment or that have poor absorption window in the basic pH, like metformin and all, that are oral hypoglycemics. So these drugs can be prepared via gastroretentive drug delivery system, omeprazoles and all. Nasopulmonary drug delivery system. In this, you basically have inhalers and nebulizers. Nebulizers, where you have to study about at least a little bit about jet nebulizers, ultrasonic nebulizers, mesh nebulizers, and vibrational nebulizers. Jet, ultrasonic, mesh, and vibrational. In transdermal drug delivery system, you basically have to study about few of the formulation approaches. You have polymer membrane mediated, adhesion mediated, reservoir mediated, but you only have to study about polymer membrane mediated. So focus on this polymer membrane mediated only. Also, then you have to know about the different excipients or different parts of a transdermal patch. You have one release liner, you have one adhesive membrane, you have one backing membrane, you have one reservoir, drug reservoir, and you have few penetration enhancers that either work by corneocytes degradation, or they alter the morphology of stratum corneum, that is the skin layer, one of the outermost skin layer. Penetration enhancers can be physical or chemical. Chemical basically include fatty acids, azones, sulfoxides, surfactants. Surfactants only non-ionic like twins and spans. So these are few chemical enhancers. Physical mein you have iontophoresis, sonotrophoresis, where you use ultrasonic waves, magnetophoresis, thermophoresis, etc. These are your physical enhancers, microneedles, and these are your chemical enhancers. The release liner should be such that you just, here suppose this is the release liner, here is your adhesive membrane, here is your backing membrane, here is your drug reservoir, the yellow one that the purple one that I'm drawing here is your drug reservoir, and here will be your rate controlling polymeric membrane. So suppose if this is your hand that I've drawn with yellow, so now here you attach this transdermal patch, remove the release liner, and then this adhesive comes in contact with your stratum corneum, and the rate controlling polymeric membrane that is present, there will be slowly the release of this drug reservoir, of the drug from the reservoir. This backing membrane prevents its leakage. That is why the backing membrane is very useful. And this can be used, the mechanism can be experienced in the can be explained in the three words: permeation, penetration, and partitioning. The penetration, permeation, and partitioning into the stratum corneum, due to which there is further diffusion and dissolution. So then this is very, very important transdermal regulatory system, because you have different mechanisms via which transepidermal, appendageal, transfollicular, via which the drug is penetrated into the skin with the help of hair follicles. And there are different factors that govern transdermal: the skin type, age, metabolism, temperature, skin nature, hydration film, lipid film, what are the physicochemical properties of a drug. That is very important. There are few physical properties for any controlled drug delivery system that you need to remember: dose, molecular weight, steady state concentration, plasma protein binding, volume of distribution, bioavailability. These are biological plus physicochemical plus biopharmaceutical properties that I am mentioning. Biological plus biopharmaceutical plus physicochemical properties. Partition coefficient, which is the log P, dose, molecular weight, partition coefficient, steady state concentration, bioavailability, clearance, half-life, protein binding. These are few of the important factors. And when it comes to transdermal, you need to know about the melting point and the skin penetration coefficient. And for gastrointestive, you need to know the density and the shape and the size. These are two additional factors. Shape and the size is mostly tetrahedron shape is useful, and 7.5 mm size is also useful. Density, if it's low density, then the density should be less than 1. If it's high density, it should be more than 2, around 2.03 or 2.004 or something like that. Half-life should be around 2 to 8 hours. Clearance should be good enough. Log P should be between 1 to 2. Bioavailability more than 75% is required. Volume of distribution should be, protein binding should be, volume of distribution should be a little low. BCS class also needs to be identified. Mostly class 2 drugs can be easily incorporated. Steady state concentration should be rapidly achieved. The therapeutic window, the therapeutic index is also very important when we speak about this controlled drug delivery system. Molecular weight, mostly it should be less than 500 to 1000 Daltons. So that is very useful. And transdermal, the dose is very less, around 40 milligram or so. While in other, the dose can be varied like up to 100, 200 milligram or so. But in transdermal, the dose is quite less. Now we speak about the inhalers. Inhalers may you have dry powder inhalers and metered dosage inhalers. Metered dose means when you press the actuator from the canister, there will be a fixed amount of dose that will be released. A fixed amount of dose. In dry powders, there might be there might be unfixed amount of dose that is released. In unit number 4, you have monoclonal antibodies, which that have a specific epitope. Now there are few steps that you have to remember in the monoclonal antibodies. First is immunization. Second is screening. Third is selection. Fourth is cloning and propagation. Fifth is storage and preservation. Sixth is characterization. These are the few steps. Immunization, you take a rat and you inject the adjuvant as well as the main antigen into the, along with the vehicle, into the rat at 2 to 3 places for 1 week. Not just at one place, at 2 to 3 weeks, so that there is more amount of antibodies produced. Then you extract the spleen. You extract the spleen, and after spleen is extracted, you remove the B cells. Now you fuse this B cells with the myeloma cells, that are the cancerous cells. Why do we do that? Cancerous cells rapidly divide and B cells are the antibodies. So we want these antibodies to rapidly divide. So we fuse them with the help of a fusing agent like polyethylene glycol, PEG, any grade, 200, 400. And we fuse them. In which medium? In HAT medium. Hypoxanthine aminopterin thymidine. Now why is this medium used? Aminopterin blocks the de novo pathway, de novo biosynthesis pathway. Go back to your second semester biochemistry, de novo purine synthesis. Hypoxanthine is obviously required for the hypoxanthine guanine phosphoribosyl transferase at GPRT enzyme, and thymidine, which acts as a substrate for conversion of nucleotides. So here you have to know about that, why HAT medium is used, why PEG is used as a fusing agent, why do we fuse these two only, and selection. Then we select the hybridoma cell, because B cell will fuse with B cells also, myeloma cells will fuse with myeloma cells also. So only few cells will be those that will fused hybridoma cell, that is fusion of B and myeloma cells. Then you clone and propagate either via limited dilution or soft agar method. Limited dilution or soft agar method. And you store them. Storage is extremely essential. It should be able to withstand the high extreme conditions like freezing, thawing, etc. And then you characterize it. You just carry out certain tests, certain that are required for the monoclonal antibodies before they are actually administered. Liposomes and niosomes. These are basically a vesicular system. They are small, concentric, bilayered vesicular systems. These liposomes can be classified as SUV, LUV, MLV, OLV, MUV, fusogenic, cationic, pH, immuno. So SUV is small unilamellar vesicle, LUV is large unilamellar vesicle, MLV is multilamellar vesicle, MUV is medium unilamellar vesicle, OLV is oligolamellar vesicle. These are vesicles that are based upon the sizes, either 20 to 100 nanometers. Liposomes are basically prepared by handshaking method or solvent injection method. That is ethanol and ether injection. Ethanol, and the other method is ether injection. And also remember that liposomes are those that are made up of cholesterol, phospholipids, that is lecithin, phosphatidylcholine, phosphatidylserine, phosphatidylethanolamine, any phospholipid you can use. And you have majorly charged particles. And there's a difference between liposome and niosome. Niosomes are more stable. They do not require special storage condition. They are consisting of non-ionic surfactants, and they consist of uncharged particles and a single tail. In liposomes, they are less stable. They require special storage conditions. They consist of charged particles, and they consist of cholesterol and phospholipids instead of non-ionic surfactants. So liposomes and niosomes are basically very small particulate systems that are very important because they help in targeted site-specific drug delivery system. Always use the words that are quite hyphenated, like the words are used targeted and site-specific. They are bang on points. Like you get, when the examiner looks at them, they get they get really attracted and captivated to the paper, because they know that this child has studied, he has gone through the literature, he has gone through the books and all. That is the reason he's having these vocabulary. So that is very important. The next is IUD, intrauterine contraceptive devices. They can be either hormonal or non-hormonal, medicated and non-medicated. They're classified into four generations: first, second, third, and fourth. So basically, you have copper T and you have hormonal like progesterone, levonorgestrel, and all. Mirena is the company name. So the mechanism of action is lysosomal activation, due to which there is a blastocystocidal action. Blastocyst जो है वो kill हो जाता है, which is spermatocidal as well. So there is competitive binding. There is no binding of beta 17 beta estradiol onto the receptor. If there is no binding onto the receptor, so obviously the fertilization and implantation will not take place. No fertilization and implantation. Ocucerts. In ocucerts, you have basically different types like bioerodible and non-bioerodible. You have ocucerts and you have one term called as lassicerts. Lassicerts is also further synonymous to mini disc and sodi and body. What is this sodi and body? Soluble ophthalmic drug inserts, bioadhesive ophthalmic drug inserts. These are called as lassicerts. While your ocucerts are basically having these three rings, you can say. One ring is EVA, ethyl vinyl acetate. One ring is actually a drug which consists of pilocarpine, Pilo 20 or Pilo 40. And the other ring is a copolymer impregnated with a titanium dioxide, which is an opacifier, titanium dioxide. So these are highly sterile, small rod or wafer shaped devices that you instill into your eye, and they can show the effect up to 7 days. While daily there is some microgram of release per hour, and mostly it is maximum dose is 20 milligram, 5 to 20 milligram in these devices. They are mainly used for dry eye syndrome. DES में you use lassicerts, and ocucerts are used for glaucoma. So these eye infections and all are not that severe, but glaucoma and dry eye syndrome के लिए we can use these devices that are very very useful. So that's all for today's video. And if you liked my video, kindly do share, subscribe, and you can collaborate with me as well via connecting with me through any of these medium. And this is my Instagram page, this is my YouTube channel, and this is my SlideShare account by Amvora. So kindly do help me with your prestigious suggestions. Thank you so much, everyone.